Right, so now we have the P2Y12 inhibitors. First up, ticagrelor has been shown to decrease mortality compared to clopidogrel or Plavix without increasing major bleeding. Reversible with platelet transfusion. Some very high-yield side effects to know: dyspnea or shortness of breath. Up to 21% of patients experience this, but it's important to know it's often mild and transient. So if patients do experience this, patients can generally continue it if they're seeing improvement, but can be severe enough to warrant discontinuation and possible change to a different P2Y12 inhibitor. There's also risk of pneumonitis with alveolar hemorrhage, although risk is low. It's important to avoid in patients with liver disease, prior stroke, or anticoagulation. So this was seen in the Plateau trial in New England Journal of Medicine 2009. Next up, prasugrel has shown to decrease mortality MI CVA compared to ticagrelor. However, it's contraindicated in prior TIA or strokes, weight less than 60 kilograms, or in patients greater than 75 years of age. Clopidogrel or Plavix, generally the cheaper option, also decreased mortality with repeat MI when load or maintenance with PCI. It does have metabolization by CYP219, and it's less effective in those with the LOF allele. So patient may benefit from gene identification in that standpoint. Patient may also benefit from PPI prophylaxis to avoid upper gastrointestinal bleeding. And Plavix clopidogrel has been shown to decrease bleeding compared to ticagrelor and prasugrel, but increase ischemic events. So there's that risk or benefit in these patients that have increased bleeding risk, especially that have had bleeding episodes like GI bleed in ticagrelor and prasugrel. Finally, cangrelor, it's an IV reversible inhibitor with immediate onset and return of platelet function in 1 hour. So it's generally used in patients with recent PCI who are unable to take PO or peri-procedure. Also used in patients with recent bleeds that have undergone a recent PCI as well. So it's that really short half-life, good bridging P2Y12 inhibitor. Next up, we'll talk about nitrates, anticoagulation, beta blockers, ACE inhibitors, and statins.